I believe the potential total addressable market for crypto in the healthcare space is in the tens, hundreds of billions. Have you looked at crypto in this space? One of the best options I found is Solve, which looks to be doing good things in South Korea with a solid advisory team in the US. Does it have a Compendium score? So this is an area that we have been thinking about for a long time, and let me explain why. So you're dead right in this area. First of all, blockchain for the medical industry is critical, starting with data security. Medical records, particularly in the US and anywhere else in the world, they contain sensitive information that needs to be secured and protected. But blockchain provides that decentralized, immutable way of storing data, making it very difficult for hackers to manipulate or steal the data. Additionally, blockchain technology can provide patients with control over their medical data and allow them to grant access to healthcare providers or researchers as desired. Prescription management is also a big area that's fraught with fraud. Excuse that alliteration there. Obviously, people try to get drugs and then sell them on the black market, etc. Or they could get the same drugs from multiple people and overdosing and into all sorts of trouble. And this way it can secure that too, because there's one record, one person, again, immutable blockchain. Whereas traditional pharmaceutical companies or stores don't have that level of technology. Third, supply chain management. The medical industry relies on efficient and secure supply of drugs and medical equipment. Just this week, I discovered that they lock morphine in a cabinet under a hospital bed just to keep it safe, because people steal it even from patients that are using it. And that's how intense this whole stuff has become. And blockchain technology can provide transparency, traceability throughout the supply chain, ensuring medical products are not counterfeit or compromised or swapped out with salt water like saline. 4, clinical trials, big, near and dear to my heart. Clinical trials are a critical part of developing new drugs and treatments, especially for key diseases like cancer. Blockchain can enable the secure sharing of data between researchers, regulators, and pharmaceutical companies, and this can accelerate the development of drug and approval and help cure patients faster, and of course lower costs too. And last one, payment and billing. Healthcare payments and billings are often complex, prone to errors, double, triple billing, etc. is just a nightmare. So net, there is a ton of efficiency to be gained from moving everything to the blockchain, not just traditional finance, which is my thing, but also the whole medical industry too. And I just touched on 5 that I see out of the box. So let's talk about your question. Sorry for that long-winded answer, but I am very passionate about this part. Now, outside top 300, Solve, it's number 702. So no, we only analyzed the top 300. So there is no Compendium score. However, I did dig into the tokenomics. And by the way, I want to warn people, I don't want to shed light on something that people think, oh my God, IA is talking about Solve, I'm going to go buy some. No, wait for this part. So first of all, really flaky tokenomics. They had a V1 tokenomics and then a V2 tokenomics. They had a hard cap in dollars of money they wanted to raise, about $45 million. At the price today, that is 1.5 billion tokens, and they said they'd have an initial hard supply of 1 million tokens. So it was all over the place. And part of this is they wanted to raise money, drip it out. They do a huge pre-sale, about 500 million tokens. They tried to accelerate, reduce the lockup period, increase the pre-sale amount, reduce the pre-sale amount, etc., etc. And the V2 tokenomics just does not make sense to me. The demand, they say, is supposed to be by publishers and partners, but there's 10 whales that own pretty much everything from what I can figure out as well. And it was hard to find all the data on this because not much is publicly available. And the asset is down 99.1% from the all-time high. Here's a chart that reflects that. The trend is clear from back in June 2020 to today. Not looking good. Tokenomics are not good. And I wouldn't touch it with a 40-foot pole. This is why we stay away from things outside the top 100, definitely the top 300.